Hi, Paul here, and I'm here at the EAES meeting in Amsterdam with Andreas Melzer, who's going to tell you about his program in Leipzig.
We're establishing the research program on focused ultrasound surgery under MRI guide.
Yesterday at the technology session, you spoke about the use of ultrasound and computer-assisted surgery with no incision surgery. And people in the audience were fascinated about that. So for the folks who couldn't be here, I was wondering if you could tell us some highlights of that.
I still can't believe it, because the surgeon would sit on the monitor and click with a mouse where the ultrasound moves to. But in fact, that's what the strange new name is: non-invasive surgery.
Yeah.
Focused ultrasound surgery under MRI guidance with robotic assistance. Some very interesting applications. First, thermally ablate the tumor, reduce the size of the tumor. Second, ultrasound at lower energy levels can support the delivery of drugs through two mechanisms. One is permeability increase of the cell membrane, and the second is release from a drug from a carrier. The other effect which we will explore and examine is increasing sensitivity of cells to radiation therapy. So to sonicate a cancer and then apply radiation therapy for improved effect.
So there's some amazing technology there.
The ultrasound goes through the skin.
Mm-hmm.
There is no needle prick, no cutting, no nothing. And under MRI guidance, the hotspot or the ultrasound wave can be localized very precisely. And MRI allows all the pre-imaging, post-imaging, follow-up. And last but not least, which is most important, MRI allows a real-time temperature mapping. So when the ultrasound applies, destroys tissue, temperature increase, and you can either say stop at this temperature or go higher. This is all very well controllable. That's why I think it's really a breakthrough in surgery.
And so there's some big potential there for that, and I know you're working on some instruments that are MR safe instruments.
That's
and
the downside.
And there was a lot of interest in the focused ultrasound with computer guidance.
Yeah.
Can you tell us a little bit about that
so
as well?
Everything is embedded. The focused ultrasound and the MRI is controlled by a computer system that manage both systems. So when the ultrasound beam has to follow a moving organ, the MRI images are taken and calculated, and detection, the tracing of the displacement of the organ is measured, and then the computer sends this information to the ultrasound, and the ultrasound follows. And if there's an obstacle, the ultrasound today have 1,000 elements. You can switch off elements to avoid to overheat any other structure we don't want to tackle, and everything is controlled via the imaging.
And it was so fascinating because the imaging is getting better, and the ability to focus and image and focus and get specific lesions that were difficult to get otherwise without any incision. So that's really fascinating and breakthrough stuff. So thank you, and I know everyone enjoyed it, and thanks for giving us information for the folks that couldn't be here.
Thank you for the interview.